Hi everyone. Welcome back to my channel. In this video we are going to talk about hyperplasia, atrophy, metaplasia. Firstly we will see what is hyperplasia. Hyperplasia is characterized by an increase in cell number because of proliferation of differentiated cells and replacement by tissue stem cells. In hyperplasia, unlike the hypertrophy, cell number is increased, which results in the increase in the organ size. It can sometimes coexist with hypertrophy. Hyperplasia, like hypertrophy, can be physiological hyperplasia or pathological hyperplasia. The two types of physiological hyperplasia are hormonal hyperplasia and compensatory hyperplasia. The examples of hormonal hyperplasia are the proliferation of the glandular epithelium of the female breast at puberty and during pregnancy. Uterus is the classical example where hypertrophy and hyperplasia coexist. In compensatory hyperplasia, the residual tissue grows after the removal or loss of part of an organ. Partial hepatic resection is one such example. Most forms of pathological hyperplasia are caused by excessive hormonal or growth factor stimulation. The examples include a benign prostatic hyperplasia, endometrial hyperplasia, which is caused due to a disturbed balance between estrogen and progesterone, and in some viral infections like papilloma, which causes skin warts and mucosal lesions composed of hyperplastic epithelium, is due to growth factor stimulation. Patients with hyperplasia of endometrium are at increased risk of developing endometrial cancer, as the pathological hyperplasia is a fertile soil for malignant transformation. Here you can see how a benign prostatic hyperplasia looks like. In all these situations, the hyperplastic process remains controlled. If the signal that initiates it abates, the hyperplasia disappears. Now let's look at atrophy. It is the shrinkage in the size of the cell by the loss of cell substance. When sufficient number of the cells are involved, the entire organ shrinks with diminished function. Atrophy can be localized and generalized. The localized atrophy includes ischemic, disuse, denervation, and pressure types. The generalized atrophy includes starvation type, senile, and endocrine types. The examples of physiological atrophy are listed here. The mechanism of atrophy consists of a combination of decreased protein synthesis and increased protein degradation in the cells. Now let's look at metaplasia. It is a reversible change in which one adult cell type is replaced by another adult cell type. This type of metaplasia is thought to arise by a reprogramming of stem cells. The classic examples of metaplasia is the squamous metaplasia of the respiratory tract. This is mostly seen in smokers, where the ciliated column or epithelium of respiratory tract is replaced by stratified squamous epithelium. Another example is the change in the epithelium to intestinal type at the lower end of esophagus. Such esophagus is called Barrett's esophagus. Thanks for watching. And that's it in today's video. We'll come up with new topic. Until next time.